why are certain communities, whether they're in rural areas or urban areas, why are certain groups of people experiencing and bearing the disease burden at a higher rate?
As part of our Food as Medicine pilot, we have launched a partnership with Dion Chicago Dream and our company to address food insecurity. And members receive a fresh produce box weekly where they come to a delivery locker to receive that fresh produce of either fruits or vegetables.
When they mentioned about the box program, we wasn't apprehensive. I came out to the first program and found out what was going on and everything else. It just pretty much motivated us more because we was always looking for different alternatives other than just eating fast food.
And so it's saying, we get these Medicaid dollars from the state. How can we expand traditional Medicaid benefits to cover these areas that we know if we solve for them, people can be healthier?
We started first as food insecurity and getting fresh produce into members' homes. Quickly realized that a lot of the produce they were receiving from feedback we heard from our members was stuff they weren't familiar with: beets, eggplants, zucchini, asparagus, trying to understand, what do I do with this? And we were concerned, a lot of them sharing like, oh, I'm not really using that. We didn't want to add to a new problem of food waste. So we really decided to step up our health education related to having a professionally trained chef and nutritionist, dietitian. He's all those three things and from the community. So he was really able to connect with the community and share new recipes, teach them skills, understand the nutrients that are coming in, all these different things. And so we added those components as this program has progressed.
Give a lot of praise to the program. I think it's important to not only have the opportunity of having the program as far as with the fruits and vegetables, but to have certain demonstrations or certain ways of how you can actually eat different types of foods so people can know more than one way to make the meals.
And so our ability now is to be more prescriptive and directive, but we've recognized for a long time that we have to really care for and think about these groups of services and this bundle of services outside of the traditional like physical health and behavioral health setting.